This is patellar dislocation / subluxation special test video by Aubrey, Alice, Wocho, and Stefan. The mechanisms of injury for a patellar dislocation could be a football player getting hit from the medial side of his left leg, and then an athlete said that he felt a pop or grinding sensation when he was hit. There's sometimes immediate pain, spasms of the anterior muscle groups, and usually a deformity if it is fully dislocated. The following videos of special tests should only be performed if there is no obvious deformity of the knee structure. If there is an obvious deformity, have the patient admitted to the hospital immediately. The next slide will show some examples of deformity, and then the video of the special test will occur. This is the Patellar test.
The patient will be in a relaxed position, and you will push towards the middle to have the excess fluid go out. And to see if the patella is floating, you will press down in the middle, and then if it is floating, it will pop back up, and that will be a positive.
So this is the Clary's test for meniscal lesions and tears. What you want to do is take the patient by the foot, have it relax, and then what you're going to do is have them move up, and you're going to have them internally rotate their leg and externally rotate either way, and then what you're going to do is have them move their knee in a figure 8 motion, in and out, while you do the inversion or eversion. This is again for testing for meniscal tears and lesions within another injury also. A positive sign of this test would be clicking, grinding. Following special test will be for medial and lateral patellar glide.
You're going to want your patient in a supine position with a bolster under his knee flexed to about 30 degrees. And we're just going to do a medial and lateral glide assessment. So what we're going to do is we're going to test the lateral ligaments first. What we're going to do is we're just going to move the patella medially as far as we can. And you're going to want the patella to move. A normal sign would to move either a quarter of the width of the patella or half inward. That's just testing for the hypomobility or hypermobility of the patella. Now we're going to test the medial ligaments. We're going to do the same thing, just by pushing the patella outward or laterally. That's testing the medial ligaments, and a positive implication would be that the patella moves a quarter or half the patella outward, and an implication would be that person or patient is more prone to experiencing a patellar dislocation.
The apprehension test for patellar subluxation or dislocation. The patient lies on bed as spine position with the knee extended and makes a 30-degree knee flexion. The examiner applies to move the patient's patella as laterally as possible, as far laterally as possible. 1, 2. Okay. We can check the patient. If patients feel uncomfortable, so, for example, patients demonstrate apprehension verbally or through facial uncomfortable or quadriceps tightness. Therefore, it is positive test.